Hello, everyone, and welcome back to Beyond Surviving to Thriving. Look better, feel better, be better by kicking MS and other autoimmunity in the butt. I'm your host, Yvette Briscoe, and I'm so happy to have our guest here today. This is Holly Warner, and she is here today because one of the things that people have asked me about a lot is how does hormones, affect what it is that we do and how we live when we have MS? And I wanted to have her on because there's a lot of confusion about what it is, how it works, and how we can make changes, even if we start with small changes, so that we can feel better. So, Holly, welcome. Thank you for being on the show today.
Thanks for having me.
So tell us a little bit about you. Give us your background and why is this the work that you do? Why did you choose this, or why did it choose you?
Oh, gosh. Okay. So, you're going to go back. I'm 41 now. This started probably in my early 20s. I got into the medical side of hormones and thought, I don't have a background for this. What's the workaround? So back in 2010, I had met Suzanne Summers and a couple of lovely other people in the Toronto area. And I was invited to a physician's training for bioidentical hormones, which I couldn't officially use. I didn't have a practice back then anyway, so it was fine. But the knowledge was there to build on. So in doing that, I kind of continued to build, went off into the cancer side of things. I have a PA, physician's assistant, director of a worldwide medical facility for a number of years. I'm at another medical facility as well. So I did that whole medical side of things and realized that prevention versus cure, I'm in the wrong area. So I thought, okay, well, you know what? Let's go back to the hormone aspect, not worry about the cancer side of things, but when hormones are low, if they're not there, like, what does that lead to? It leads to inflammation in the body. So it kind of spiraled from there into a bunch of different training that I went into. I decided, nutrition obviously is huge. So I did my master's in the science of nutrition. I did clinical nutrition and integrative health. I kind of continued. I did functional diagnostics as well, which was, fantastic for the diagnostic side of things, to add to the training I already had with your standard allopathic labs that we use, right? But the functional markers, so looking at your thyroid and looking at your hormone, but really that comprehensive look of things where it's not just testing one or two things, it's testing all of them and the systems that support them. So you have this big picture instead of just one corner shot. Because I can't put pieces of the puzzle together if I only have a viewpoint of the corner of the puzzle. I need the whole puzzle. I did, about a year and a half ago, I did an ICP, which is an in-clinic preceptorship under Dr. Konigsberg in Toronto, which was fantastic, to just, always make sure that I'm on the ball and I'm on top of things and the data that's out there. I became an LDN therapist as well because so many of my patients came to me that with autoimmune thyroid disorders, Hashimoto's, MS, you name it, Lyme disease, fibromyalgia, chronic fatigue. The list is massive for LDN. So I thought, why aren't we utilizing this? This should be a part of even just allopathic medicine. So I delved into that. The cannabinoid therapy side of things, as we all know, cannabis is huge now. It's becoming legal everywhere, and everyone wants to, have their hands in the pot. And do I use CBD? Is THC right for me? What modality am I using? So I kind of put everything together. And about, I'd say 6 going on 7 years ago, I said, listen, I may not be a doctor, but I've done all of the courses that they've done, and then some. Why do I not open my own clinical practice and hire doctors and hire nurse practitioners? So when a script is needed or blood work is needed, and whatever we need, including controlled substances, which DHEA, an important hormone, is considered, there are no limitations. Unlike referring to a naturopath where they might have those limitations depending on where you are and the regulatory boards that they're under. So I don't like having limitations and I don't like being told no. So I hired all of the right people to build this amazing team. And they don't work for me. We work together. We are a team. Everything goes back and forth. And the results just ended up being that it was this perfect fit of all of it together was the answer.
That's amazing. One of the things that throughout this series, I am always encouraging people that when you want to be in charge of your health, you need to have a health team, a wellness team. Trying to do it alone or taking one perspective is not what's going to get you to the end goal. So really glad to see that that's something that you've taken a really active role in promoting the team concept. So that's amazing. So one of the things that you talked about was LDN, and I want us to kind of dive into that. Low dose naltrexone is not widely known or talked about, and so I want to give everybody sort of a foundation, what it is, how it applies, how it helps, and they can start considering whether or not that's an option for them. So tell us a little bit about it.
So with MS, we know inflammation is a big issue, right? So if we can reduce the production of those pro-inflammatory cytokines, that's amazing, right? And that's what LDN does. So now, to bring it back to what is LDN, naltrexone is an opioid therapy. It's to block opioid receptors in the brain. It's for those who have an addiction to opioids in massive doses. And I say massive, 50 milligrams plus. But when taken in minute doses, which is where low dose naltrexone, also known as LDN, comes into play. I mean, starting patients at 0.5 milligrams, slowly titrating them up every 2 weeks. If you go too fast, it's not good. You start low and you go slow. You gradually build, you titrate every 2 weeks by 0.5 milligrams. So you go 0.5, then you go up to 1, then you go up to 1.5, and it can take as long as it takes to get you to where you need to be, a maximum of 4.5. That's a super low dose, but that's all we need. And I have patients who are on the 4.5. I have other patients that have been on 4.5, and we brought them right back down to 2 or 2.5 milligrams because that's their magic number that they do so well with. It's really about low dose. And you don't get all of those side effects that you get with so much else that's out there.
So that's actually what I was going to ask you about. So are there any side effects that you have experienced with your patients, or, when we're talking about introducing something that's different and new, the body is going to respond to it. It always does. And sometimes it's a positive response and sometimes not so much. So tell us about your experience with that. What, if any, are the negative side effects that people have experienced? Or what are the, what do you see as the benefit? Like, what is the tangible, I noticed this and it's so much better thing that you see most often?
Okay, so it's very individualized. It is an off-label use of the drug. So because it's not its typical opioid receptor blocking use, it's not for that therapy. With the off-label, they've done a lot of other studies based on here's what we see. And MS is one of the study groups that actually is becoming heavily studied, which is fantastic. So if you are suffering from MS and you were to Google, not that I'm a fan of Google, but if you were to Google LDN and MS, it will populate with all of these studies. You can also go to ldntrust.org, type in your condition, and it will show you all of the studies that are out there that are credible studies and what they're showing. Even the minute positivity all the way to the negative. So now every person is different. I haven't seen anything negative with my patients that would be anything to write home about, which is why we go so slow. If you go to a practitioner who doesn't understand what they're doing and they jack you up to 4.5 milligrams immediately, you're going to poop yourself. Your tummy's not going to be happy with you. You're going to have just a bad time until your body, ooh, okay, I see what's going on. That's why the rule of thumb with LDN is start low and go slow. Gradual. Side effects can be, yes, a tummy rumble. You can get some loose stool, a little bit of nausea. But when you start low, you don't typically get those symptoms. Now, some patients do find that it disrupts their sleep, in which case I say instead of taking it at nighttime, we'll take it in the morning. You might get vivid dreams. I've had some interesting conversations with patients where they've said, so that was a very vivid dream, and thank you. Or, ooh, that was a lot. if that's all the side effect is, we can cope with that for a couple of days or a week, but it does settle within a week. So it's not really anything that's that bad. And that's it. That's all. Like that, those are your side effects.
Now, when that happens, the vivid dreaming, does that happen each time you titrate up, or is it just in the beginning and then your body's kind of used to having this new substance, even though you're changing the levels?
Typically, it tends to be the initial dose.
Okay.
Once that's settled, your body seems to go, okay, I understand what this is and I know what to do and I understand the mechanisms, and off we go. So if anything, you might find that when you titrate up, if your body was good with 3.5 milligrams and now you've moved up to your 4 milligram dose and you go, ooh, I feel a little off, my tummy isn't feeling good, or I'm running to the bathroom, then you just go back down, because maybe that lower dose was your dose. That's your magic number. And you'll know. We know our bodies.
Yes.
So there's that. But for the most part, the vivid dreams, once they're gone, they're gone. If you have surgery, you have to come off of LDN, because your pain meds are not going to work. It is a low dose, but it is still an opioid blocker. So if you're on cannabinoid therapy, it does work very well with that. There's no contraindications. But if you're going to have surgery, you have to come about 2 weeks prior to be on the, even though the half-life of it is not 2 weeks, we still warn 2 weeks prior to surgery, and then you wait a couple of days post-op and then you can resume. But if you're taking, if there's an emergency and you're taking your pain meds, that's not going to happen.
So I know this wasn't one of the things that we were planning on talking about, but since you mentioned it, I thought maybe we could just touch on it just a little bit, which is the cannabinoid therapy. So there's some confusion sometimes between a product with just CBD and a product that also has THC, and the benefits, the side effects, should you, shouldn't you, all of that. And so I've had so many questions about it in my studies and research. One of the things that I found that was concerning for me is that if you are one of the people with MS who is experiencing cognitive issues, then using something that has THC in it is not a good idea for you, because it shows some additional cognitive challenges. But using CBD without the THC wasn't a problem as far as the research is concerned. They didn't see any negative effects, and then the positive benefits were pretty significant. So can you just kind of like clear up the confusion a little bit about, CBD by itself first, and then why you would use a product with THC if that's the thing that you choose to do?
Okay, so cannabidiol is fantastic. Now, I do a lot of genetics within my practice. Epigenetics has been my jam for about 10 years now. I love it. I love looking at the human genome. I test a lot of my patients properly, not 23andMe, but from McGill University, real genetics testing, not in someone's garage like some of the kits are. And I look at the hormone pathways. And this is very important for those with MS, because you need to know what's happening with your vitamin D, because that's a huge component with MS. And if you've got conversion issues or absorption issues or utilization issues, genetically, we need to fix that. We have to look at how we do for the workaround. Are you testing it properly? And that's another thing that we can get into when we talk about the hormone aspect, because vitamin D is a hormone. So we look at that. We look at the entire endocannabinoid system and we say, are you one of those people that has a propensity to not do well with THC, but more specific, looking at the chemovars, the chemical varieties, which some people call strains. They're not bacteria, so they're not actually strains, but take your poison. And then looking at the terpenes, what terpenes are good for specific conditions. So it isn't actually that THC specific might be the issue, but perhaps specific terpenes. So if you can pick out and differentiate and isolate the terpenes that are beneficial versus the ones that are contraindicated, then that's a whole new ballgame. That being said, cannabidiol, you can get CBD from a hemp plant or from a marijuana plant. Male versus female. There's a synergy with both. I have a lot of patients, myself included, who cannot tolerate THC. I can't smoke it. I can't use it orally. I don't use it in a patch. I can use it in a vaginal suppository for endometriosis or, vulvodynia or any of those things. Not saying that's me, but like in general in my practice. So again, it depends on your own genetic endocannabinoid system and how you respond. I prefer CBD within my practice for most patients. If THC is required, which I don't typically do for MS patients, you're correct there, the CBD is going to work. It's going to lower your inflammation. It's going to work on any of the CB2 receptors, which are throughout the body, whereas the CB1, which THC hits, most prominently in the brain. There's a few scattered throughout the body, but predominantly they're up here. Now, that being said, I would say, yes, go for CBD. Make sure you know what you're getting. Make sure you know where it's coming from. You're going to want to know mold in the soil. Not that it's necessarily going to transfer from the plant to the oil, but it's always good to know because that can create an issue for patients with MS, of course. You're going to want to know pesticides, herbicides, fungicides, any of that. You're going to want to know what the terpene profile is. Is it full spectrum? Don't look at the isolate. Look at full spectrum because of the synergy. How was it processed? Was it CO2 extracted, which is good, or were there chemical used? Again, the chemicals are not good. You have to take everything into consideration, how it's packaged, the quality, all of that. And then what's your magic dose? With CBD, lower does tend to be better. However, if you have a sluggish liver, it's processed by the liver. So you need to make sure that you're doing everything you can to make your liver healthy. Because you can be taking 1,000 milligrams and only utilizing 10% of that. So you have to make sure that that's on point. Omega-3 specifically feeds our endocannabinoid system. So if we are deficient in omega-3s, again, that endocannabinoid system isn't going to be utilizing all of that maybe 10% that we were getting. So now that 10% maybe went down to 2%. So those that say, oh, CBD didn't work for me,
why?
It's not that it didn't work, but we need to do it differently. Again, you need to understand that taking it with vitamin C negates the benefits. So don't take vitamin C with your CBD. You don't want to take them at the same time. These are the little snippets that I tell people it's very important to see someone who's trained and understands so that you get the right knowledge. Because if you're just buying it willy-nilly from somebody who's like, oh, it's amazing, it helped me with my back pain or my MS or my leg pain or my sleep or whatever, here, try it. They don't have that background. So you don't know what you're getting, but B, you're not getting the important information that are you on blood thinners? We need to know that. You need to be very conscious of that.
Well, I think that, it's particularly important for people with MS because MS is a snowflake disease anyway. Everybody is different. Everybody has a different combination of symptoms. And so if your disease is that different, then the things that you do for it should be individualized as well.
100%.
Yeah, and I'm glad that you're talking about, you're just showing that it's not as simple as people make it out to be. It's a very complex thing, and don't try to do it on your own. Get help. I encourage people all the time, one, yes, I've done research on it, but that's not my area of specialty. So I bring somebody on who can provide that information to help you make the decision for yourself, right? Because it's all about a series of decisions that we make for ourselves. Mm-hmm. And, some people are like, oh no, I'll just my neighbor and that sort of thing. And I'm always encouraging people, educate yourself and then go to the person who has more education than you to make your decisions, right? That's kind of how we get better and how we make the right choices. So thank you for that.
Let me put it this way. I've been studying it for a few years. It wasn't part of my original wheelhouse. I've been studying it. I've taken the medical courses for medical cannabis use. And I still don't know a quarter of what I need to know to consider myself, I say prescriber, even though I don't have legal rights to prescribe, which is why I'm that front line to explain and get the information out to patients. But when it comes time to prescribe something or get into a treatment plan or if THC is required, I have a team that I refer to where there's a compounding pharmacist who is a cannabinoid expert. He's probably more knowledgeable than anyone I know when it comes to that. And on his team, he has someone who does the education portion of it. And nobody can educate you like someone who's been, for lack of a better term, smoking pot for 20 years for their own illness. Right. So They know, they understand this strain isn't going to work for you. This chemovar is not going to work for you because you've got this type of anxiety. You know, I have people that come and they take the CBD for anxiety and they go, holy heck, like now I have insomnia and like this isn't, well, whoa, time out. You have insomnia. CBD is not what you want. You want some THC in there. You need to get a script for that. Or if you're suffering from chronic anxiety, not just situational, like I have to talk on a stage in front of a couple of thousand people, have some CBD, but like that all the time, just this is anxiety for no reason. That's chronic. CBD is going to make that worse because you're going to get like a sugar spike up and down, up and down. And I see MS patients that have the anxiety portion of it where I say, you want a patch. You want a slow release patch that's continual for that 24-hour period so you never crash.
And I think too that one of the problems with some MSers is that they haven't identified the anxiety. So, you know, you feel this heaviness in your chest. It feels like somebody's got their fist just kind of sitting there, but you don't acknowledge that that's actual anxiety. And so then that's another reason to talk to somebody because they can say, you know what, that kind of sounds like anxiety and maybe this isn't the process for you. Let's do something differently.
Yeah.
So, yes.
That's so important. And see a practitioner that checks in on you. I will randomly check in on my patients and shoot an email and be like, hey, how did your retreat go? Hey, how did that go? Oh, I saw in my calendar you were supposed to see, your specialist for an MRI 2 days ago. Did they say anything? How are you feeling? How are you doing? Check in. And I think we've lost that connection as clinicians a lot of times. And so I set aside the time in my day and I set the little reminders so I don't forget, so I can touch base, because sometimes you get that one patient who goes, I'm really glad you reached out. I'm having a breakdown. Oh, okay. What's going on? Well, I tried this and it's not working. Okay, let's stop that supplement or medication or whatever it may be. Let's look at another avenue. I'm not going to bill you for that. This is still part of the initial treatment that we've been doing. This is me just checking in to make sure that what we're doing is working. And if it's not, scrap it, go in a different avenue. Now we know.
That is so huge too, because one of the other things that in my support groups, my online support groups, I've had lots of people comment that sometimes it feels like you're on this journey alone, because sometimes you're like, if you're seeing a neurologist, there is no in between. It's just whatever your scheduled appointment is, that's the time that you get with them. There's nothing else, and so you feel and it's not that they're neglecting you, it's that that's not their mode of doing things. It's not they're providing the kind of care that they provide, which is another reason it's important to have a wellness team, right? Because a health coach will check in on you. So that's it's such a huge component, and I get why people feel neglected. I get why people don't feel completely supported and sometimes feel alone. But also, that's another reason why I'm constantly encouraging people to have a wellness team and to make sure that you have the right players on the team. Because, you can have a huge team, but if you don't have the right players, you're still going to lose the game. So, yes. So yes, I strongly recommend it all the time. And I know people are like, well, what do I need, this person for if I've got that? And I try to say, and I like that you use the word synergy, because that's exactly what it is. Yeah. Everybody works together to get you to the ultimate goal. And if you don't have that synergy right, if it's not connected right, then you're not going to get to what you're trying to get anyway, which is relief from your symptoms and to live your best life. So yeah.
I mean, I'm not out there saying and making the claims like I can cure your MS, but ideally, let's see if we can get you asymptomatic, meaning living life with a disease that doesn't make symptoms anymore.
Yes.
I have a diagnosis of Hashimoto's. My labs don't show it. My antibodies are back down to normal. My thyroid medication, I'm not taking it anymore. I'm living life to the fullest. I know that it's still there under the surface, just waiting for me to do the wrong things, and it'll come back. But right now, do I say I'm in remission? I say I'm asymptomatic. Do I still have Hashimoto's? Not right now. So let's keep it that way. But it's a
Exactly.
journey. So, and I find a lot of people want to right away, you've been suffering for so long that you just want all of it right now, immediately, 100%. And you have to be patient and take those deep breaths and say, like, listen, it took me this long to get to this point. Now let's see how long it's going to take me to get back to the healthy part, as much as we can. And if it's only 85%, 85% is a big number.
That's, I think that is so huge too, because, even 25% better than you were a month ago is better, right? And that doesn't mean that's your upper limit. That just means that's where you are now. I kind of related to weight loss where, when I was overweight, initially I was trying to just, drop it as fast as I could. And my mother, she's a registered nurse, and she says, you didn't put all of that on overnight. Why is it that you think you're going to be able to take it off that way? And let me tell you, if you drop it too fast, it's just going to come back on, which was my experience, right?
Exactly.
So if you have a system and a method that is grounded in science and, doing it the right way, then you don't have those same issues where you're going back and not being able to maintain your results and that sort of thing. So I think it's amazing what you're doing. I love just the structure that you have that is so supportive of the patient experience and moving them forward to where they're trying to get. So that's amazing. I do want us to dive into hormones because, again, it's one of the things that, when you're diagnosed with MS, that is not something that the person diagnosing you talks about. They just don't.
No.
They tell you what you've got. A lot of times you get sort of a doom and gloom outlook on things, and then you're left to your own devices to figure it out. Yeah. And people don't, on their own, think, well, first of all, not very many people who haven't had some kind of training or formal education realize that vitamin D is a hormone. You don't, right? That's not what you think. And then, they know that stress is really bad for people with MS, but why, right? What is happening? What's happening with the cortisol production? Why are your adrenals acting the way that they are? Because of what's happening with your hormones and your levels and things that you don't think about when you have MS. When you have MS, you're thinking about, I'm fatigued, or you're thinking about, I'm having numbness, I'm having pain, look at this migraine, but you're not thinking about the underlying issues that are causing some of those symptoms or exacerbating them. And that's where you are coming in today to tell us about that and to help us understand a little bit better how we don't have to suffer from it if we balance things out.
So hormones are, I like to say, like you're sitting at a piano and you're playing a song. So if you have one key that's out of tune, but only a little bit out of tune, and three others that are majorly out of tune, you're only going to hear the three that are majorly out of tune. You're not going to really notice the other one. Mm-hmm. So we attack those three, and then all of a sudden you see this other one, and you go, well, that's out of, now that's out of. No, it was always out. We just couldn't hear it because the other ones were louder. They were worse. So once we have everything tuned, we play this beautiful song. The hormones are a song. So you have to make sure it's the right balance. You don't want too much. You don't want too little. And there's a lot of theories that go with hormones. Some that are not even being spoken about in the MS community, which I've kind of put some feelers out as to why are we not talking about this. I guess the literature is new and we're still trying to wrap our head around it. We talk about estrogen and we talk about testosterone with regards to MS, but nobody mentions progesterone.
That's right.
So when, then I see this really common, especially with any of my MS patients that have had previous concussions, because while progesterone is not predominantly produced in the brain, it is still a neurohormone. As a neurohormone, it's protective of our brain function. And if we don't have adequate amounts of that, it's been thrown off by a concussion, or we just don't have enough, what happens? Neurological issues. Well, that goes part and parcel with MS, right? We've got to protect the brain, and progesterone's doing that. I mean, it's going to protect the gut, a lot of people that come to me and they say, oh, I have gut issues. And I say, let's test your progesterone. Turns out it's low. We bump it up with bioidenticals, and I can't stress that enough, not your typical synthetic hormone replacement therapy, but a bioidentical version, biologically identical to what your body produces. There is a difference. You see, they take it, it's oral, and they go, my gut issues have almost completely disappeared. Well, yeah, because you gave your body that hormone that does a little piece of that job that has to do with the digestion and everything else. Again, people aren't really talking about these two issues very much. I've seen it in clinical practice. I've connected the dots and I've gone, we need to do some more studying on this. There's something to be told there. Estrogen, if it's elevated to a certain degree, it seems to diminish the inflammation and the effects that we have of the inflammation within the brain, the estradiol and the estriol, right? So you want to make sure you're testing those two estrogens to see where they're at. So you don't want it to be sky high, because then you're looking at estrogen dominance,
right,
with the issue of progesterone estrogen ratio. It's got to be just so, but you want to make sure it's elevated enough that you have that protection from the inflammation. Same thing goes with testosterone. Now, fun fact about testosterone, we look at men and MS, and they tend to develop it less frequent than women and later in life. What is the difference between men and women? Testosterone levels. So if men have higher testosterone, which protects them, and then it starts to drop as we hit andropause, and then comes MS. So we bump it back up, and it's showing in studies to prevent as well as reverse. So then logic dictates for women, our testosterone levels are obviously not quite as high, but maybe we want to boost those up a little bit. And we look at the human growth hormone. There's virtually no studies. They're very new. We know that if your testosterone is not on point, there's no sense even looking at the growth hormone aspect, because the testosterone has to be utilized properly to be able to feed that growth hormone. So we go back to the testosterone aspect of it and make sure that's like on point. Very important.
And I just want to just clarify real quick. Women do produce testosterone.
Oh, yeah.
So many people don't realize that. And that's why it's never a concern for women, because they don't believe that they do it anyway. And so not knowing that you're producing it means that you're not going to check your levels, and you're not going to see where you are with that. So you're not going to balance it and have the right levels. So yes, women do produce testosterone. And yes, you should make sure that that is in balance.
And you want to look at both your free and your total testosterone when you're doing your blood serum testing. So when we look at men, we look at the fact that we're like, oh, okay, elevated testosterone protects from the disability aspect of MS. Well, then why would it not also do the same thing in theory with women? We need testosterone. I mean, your libido, that's testosterone. Mm-hmm. You need your muscle tone, that's testosterone. So we just don't need as much of it, but we do definitely. It's one of our vitality hormones. When your testosterone drops, where's your drive? Not just your sex drive, but your drive in general. It tanks. Too much, you're going to get, obviously, you're going to break out. And that's the thing I see with women. They go, oh, you put testosterone on my requisition. I think you made a mistake. No. We need to know. And then it's tanked, and I say, okay, we're gonna put you on some testosterone cream. You're going to apply it to your labia. Put it on in the morning after your shower or whenever, because there's risk of transference. And they say, no. I don't want to get acne on my back or my skin to break out. I don't want my hair to fall out. No, it's not. We're not giving you a male version of this hormone where you're getting a massive amount. We're giving you enough for you as a woman. It'll be okay. And, once they kind of get past that and they go on it, most of the women kind of message me and go, oh, hey girl, hey, what? This is amazing. And my husband says, thank you.
Well, and that's the funny part about it. And again, why I say, make sure you have the right wellness team, because if that's not the conversation that you're having, then there's a part that's missing, right? So just the response that you get from those patients once you educate them and help them in that area, right? That is something that they never even considered before, but oh man, do they love the results, right?
Yeah, absolutely. We don't think about it. We think, oh, I need to look at my estrogen.
Yeah.
Oh, well, there's more to that story. So what about, oh, progesterone, oh, pregnenolone, oh, DHEA? What is that? Hang on. Oh, there's a ton of hormones. Yes, there are. There are.
Yeah.
A lot.
So we are actually getting short on time, and I want to make sure, one of the things that I do for every episode is to make sure that people can walk away, when they're finished watching this, they can walk away and do something today to make an improvement, to feel better, to make a change, to move them forward on this journey. So if you had to give somebody 3 things that they can do, and of course, they don't have to do all 3 of them, but like, you know, from these 3, pick one thing that you can do to feel better today. What would it be?
Okay, so 3 of my super easy, super fun, really effective, and totally free things that I tell all of my patients is mouth taping.
Okay.
Look into it. Google. A colleague of mine, Mike Mutzel, he has a video on YouTube, so you can just type in mouth taping. Mike Mutzel's video comes up on YouTube. It's hilarious, but my patients always come back and go, what? Start really slow. Just start with like 5 minutes in the evening watching TV and work your way up to like 20 minutes and then 40 and 45, and then do it all night. It goes this way. You're not duct taping. We're not kidnapping you. Just here. Just a little bit. We don't want to create more anxiety. But mouth taping encourages you to breathe through your nose. You'll sleep better. You're not going to disturb that mouth microbiome that you would get with mouth breathing, which really does affect the rest of the microbiome, the gut, etc. So mouth taping, look into that. Chew your food. We don't do that. We don't chew our food, and that's very important. It releases those enzymes, and that's the first step in digestion, utilization, absorption of everything within the gut. Very important. The bacteria, we want to keep that all balanced. So,
and with that, put the fork down in between bites.
Yeah,
put the spoon down in between bites so that you actually take the time to chew it without being encouraged to take the next bite before you're ready.
Good 20 chews,
Absolutely.
And 20 is a lot. People go, 20, no problem. Well, by the time you get to that 4th bite, oh, that's my jaw is sore. Yeah, because you're not.
It's a new habit that you have to make. And because we don't, I didn't notice that I wasn't doing that either until when I started my health coach training, and that was one of the first things that they told us is to be mindful, like observe what you're doing. And I was like, oh my God, I wolfed down my food.
It's true. We're a go-go society, and that's another thing. We're wolfing it down and we're not chewing properly. So we're chugging the water back to get it while you're washing away those digestive enzymes. Your amylase is produced in your saliva as well as the pancreas. That's one of the first enzymes to be released. You need all of these to trigger all the rest. So don't drink, chew your food, mouth taping, and get some more electrolytes into you. Some salt water, a Soleil, S-O-L-E, Soleil, first thing in the morning, feeds your adrenals. Your adrenals are fed by salt, so a nice pink Himalayan salt in the water first thing in the morning. Make a Soleil and then add it. It's better than just adding the salt. You want the Soleil. Drink it first thing in the morning. You can thank me later.
I'm going to thank you now because that's great. And that's, I have so many people who are paranoid about salt, right? And I keep trying to explain to people that it depends on what kind you're using. So when I'm encouraging people to use salt, I'm not saying take table salt and, and increase your sodium levels. What I'm saying is I have Himalayan salt, I have sea salt, I use those instead, because if you do it the right way, then there's another way you're balancing levels, right? And you're getting the natural benefits from it. So thank you for that too. All right, you've got a free gift for us. Tell us about that.
Because I didn't get to cover everything, and I knew that I wouldn't, I didn't touch base on the thyroid hormone and its importance for protection and reversing with MS, the vitamin D, how to properly test for it, which is really important, your 25 OHD, your 125 OHD, and your RBC magnesium, throwing that out there. I'm giving away my consultations, which are typically $75. You get me for like a half an hour-ish. I'm never right on the clock. Sometimes it's 35 minutes, sometimes it's 40. If you need me, I'm not going to hang up on you. So you're not going to get a protocol, you're not going to get a treatment plan, but you are going to get to almost kind of pick my brain a little bit, where we'll talk about what I see is going on and things that maybe you want to look into. And even if you don't come on board as a patient of mine, with that consultation, I can say, hey, you know what? You might want to look at testing the microbiome, look into the U-biome test. Dr. Grace Liu, she's, part of that home human microbiome project, and, Dr. Knight, I'll put you in that direction. That I'm happy always to facilitate, hey, look into this or look into that, or this might be a good test for you, or you might want to try this. So again, as I say, there's no treatment plan, but there will be tons of little tidbits and suggestions. And you can talk to me. It's a good chance to have a conversation and maybe learn a couple of things.
Yeah. And I'd also, have to connect with you for your availability, but when we get to our module in my program on hormones, I would love to have you come in and do a Facebook Live with us and just talk about, it is a huge topic, and we can't cover everything that we need to. And I took so much time on CBD because it's something that people ask me about all the time. And so we didn't get to dive as deep as I wanted to on the hormones, but I think that the information that you gave as a starter point is super important, and the testing is huge. We actually have people get their labs done before we even start the first week, because you need to know what you're working with.
Oh yeah.
Where do you go if you don't even know where you're starting, right? So
exactly.
Yes. And so, yeah, I would love to bring you on board and just have you talk to everybody and give us some more information. That would be amazing.
Absolutely. It would be my pleasure.
All right. Well, thank you so much for joining us today, and just really awesome stuff that, really actionable steps that people can take today. And then, the offer is amazing too. So everybody, I want you to make sure you click on the link below so that you can schedule your consultation with her. And then we also have all of her social media stuff on here. Click on those links as well. Connect with her. She puts out some really great information, and this is something that's going to help you in your journey to feeling better and being better with MS. So thank you again. You were amazing.
Thank you.
All right. And guys, we'll see you on the next episode of Beyond Surviving to Thriving.